Hello, I am Dr. Karthik Rao. I am Additional Director, Urology, Uro-Oncology, Robotic Surgery at Fortis Hospitals, Bangalore. Today we have with us Dr. Mohan Keshavamurthy, Senior Director, Urology, Uro-Oncology, Renal Transplant and Robotic Surgery. We are here to discuss about robotic surgery. Sir, what are all the urological procedures which can be performed using the robot?
Again, a very interesting question. If you go back in time, the Da Vinci robot, which is the dominant robotic platform in the world today, 75% of all procedures are done on the Da Vinci platform, was first started off with cardiac surgery. But the successful nature of adaptation of the surgical process to the robot was in the field of urology. 1/2 of all procedures done worldwide are in the realm of urology, because urology, especially in the male, is an android pelvis. It is a V as compared to a U in a woman. In a V, you can visualize, but to reach the area of interest is very difficult. It's very similar to colorectal surgery. You can see the organ in the V, but very difficult to reach, to remove and to suture. So in urology, one of the major areas of utilization of the robot is in uro-oncology. So whether it be nerve sparing robotic radical prostatectomy or organ sparing robotic partial nephrectomy, especially those tumors which are mid-pole, hilar with a very high nephrometry score, complex location or complex tumor. Then in removing the bladder and reconstructing the bladder either with ileal conduit or with a neobladder. So one area where urology is enhanced by the robot is uro-oncology. The second area of interest obviously is kidney transplant. It has allowed us to do right-sided kidneys or kidneys with multiple arteries or second transplants, or patients who have multiple abdominal surgeries before with adhesions, or pediatric patients with small amount of space, or patients who have unanatomically or a large kidney, as in autosomal polycystic kidney disease. They need a pre-transplant nephrectomy. So it has made difficult transplant recipients into an easier procedure with better outcomes. That's the second area of interest. The third area of interest is in reconstruction, whether it be pyeloplasty in a child. We can go down to as much as low body weight as 5 kgs, or a redo pyeloplasty where the first open or laparoscopic pyeloplasty has failed, what we call as a salvage pyeloplasty, or an ureteric injury, especially in the modern era where RIRS or flexible ureteroscopy is done for stones in the upper ureter. Injuries are common. Repair was horrendous, very difficult to do by open or lap surgery, but we can now do robotic buccal mucosal ureteroplasty. So the third indication in urology is in the realm of reconstruction. The fourth area is possibly an area which will expand rapidly. It is to manage incontinence. So in the female, you can do sacrocolpopexy, especially when there is descent of the vagina after hysterectomy, or descent of the uterus itself, when you can do hysteropexy, or a small capacity bladder where you can do augmentation cystoplasty. So the fourth area is an area of surgery for incontinence. There are innovative applications of the robot, one of which is in robotic simple prostatectomy, an area of interest at Fortis Hospital's Bannerghatta Road, where gland size more than 150 grams, you can go ahead and do a robotic simple prostatectomy. So this is one of the benign indications. It's also for reconstruction of the bladder neck. Prior robotic radical prostatectomy, the bladder neck has stenosed, or for any reason the bladder neck after repeated surgery has so scarred that conventional approach is not possible. So overall, we have used it even for robotic pyelolithotomy, very large stone, along with pyeloplasty. So overall, uro-oncology, kidney transplant, pediatric urology and reconstructive urology, difficult anatomy irrespective of the pathology, and surgery for incontinence. These are what we call as urogynecological indications. These are broad areas where the robot has made a huge difference to urological practice.